Thank you, Craig. So my name is Samir Thapa. I'm a National Technology Lead for all communications within Microsoft Health and Life Science, and I cover all the accounts in the US. As you see, I've been there, done that, all the voice stuff back in the days, from the Cisco Voice to and Microsoft Voice Communications and so on. And there are my email address. I am in Los Angeles, PST time zone. Feel free to connect me in LinkedIn. You can see that picture in LinkedIn quickly to identify, and we can have those connections going. So let me go to next slide. Why it's not clicking? There we go. Okay. So let's talk about health industry needs and challenges, right? So as technology grows, the patients wants to connect in more different ways, collaborate more different ways, and hospitals or healthcare industry also wants to reach more patients, right? And they want to add new lines of care, optimize staff utilizations, and optimize efficiencies, facilitate care transitioning from one care to another care. Ease of use of adoptions of those things, and then there are too many apps to do things. Like meeting is one app, and video is other app, and talking to patients to other app. And there's a compliance, privacy, and security concerns out there, and it's just overwhelmed, right? It's just too many things to manage. Where Skype can be one client and can do most of these use cases from one client, one app to meet the healthcare needs. So I'm going to take you through the other slides, and we will deep dive into what it looks like and what it can do. So let's take a look at a holistic approach, right? So what's collaborative healthcare? And you see, universal communications means for healthcare. So as you can see in this picture, there's a Skype for Business, CloudPBX with E5 licensing, of course. That's that comes with it. The physicians in office have the equipment, the camera, the phone, everything's ready to go. And with this, single Skype app can do all the modalities of the use cases. And there's a community health centers, there's a wheels in the cart, there's a dual monitor, can do audio, video, and can see those reports in real time and annotate and do collaborations, right? And also there's patients waiting rooms and lobby. They can have these collaborations going. Patients at home, they can collaborate with doctors and care providers, and this just what Skype can do with its own functions is amazing. It can reach out to all the healthcare needs and modalities for communications and collaborations. So the next slide we're going to talk about in maybe 4 different verticals. There are many, but it just highlights 4. Is the healthcare administration is one of these. You can use as board meetings, recruitment and interviewing, project management, supplier vendor relationship, right? You can, this administration side with knowledge workers, they can use a Skype for that particular use case, where education piece in medical practitioner, live room videos, in a broadcast, what John was talking about. You can do a live broadcast of this large audience meetings, right? And telemedicine applications you can do in a specific those departments like dermatology, infectious disease, or maybe there is the pediatrics, or whatever the department, they can use those telemedicine applications. You can build those applications also. You don't have to say Skype app. You can have your own app. Backend engine is running Skype, and then have this conversation going, with the patients and doctors and care providers, and then patient-centric care like peer-to-peer and coachings and tumor board settings, and in discharge planning, case management. All the modalities can be covered through the Skype. So in the next slide, let's talk about why Skype for Business, what it really looks like. If you haven't seen in the past, the Skype for Business, it kind of look and feel like a Skype, but it is a Skype for business use. The reason is it's back-end engine, it's the security, the compliance, all are built in to one app. There is, it comes with Office Pro Plus, and then once you deploy and you sign in with the Active Directory sign-in, and that's it. You don't need any other credentials. There is no other third-party apps to integrate, and it's just very elegant to design. just by looking at, you can see there's a person you can join, and you click, you can talk to, you can audio and escalate to audio and video, and it's very easy to deploy, and and clinicians they can use for many different use cases. But a lot of our clinical workers are very they highly use this because they can work from anywhere. They're running around the hallways. They're going to different room settings. They have this app. They can have this phone ring in their desk, whatever their desk is. Their phone rings on the app, so they can pick up the call from anywhere. Right? They don't have to in the desk. They're mobile. The care providers are mostly they're mobile. They're going to different room settings. The nurses are running around. The doctors running around. It's just one app gives you all the communications you need. Executives, administrative staffs, everybody can be in one settings and one app. That it's just easy for them to use. So let's talk about the Skype business deployment model, right? So we're talking about online and hybrid on-premises. So on-premises, we've been there for a very long time. Online, in a couple of years now, and all these modalities we just covered, it is available in online. And hybrid, if you already have Skype business deployed on-prem, we can integrate with your online and a hybrid. Either you can migrate the users to the cloud, because that advantage of hybrid, or you can connect to your existing communication systems like your existing PBX, Avaya, Cisco, or Nortel, ShoreTel, whatever you have. You can configure those, connect to your online users, cloud users to your on-prem PBX systems, and best work together. So if your on-prem system rings, your online cloud client, a Skype client, can ring too. So it just creates the best of breeds communications model, and then you have options to choose either one, or use both, or retire one, like retire old legacy PBXs. It's up to you. It's up to the user to choose which one they like to use. What's the best fit. So let's talk about what are the devices available. A lot of times healthcare providers they just think the healthcare in Skype is just an app. But however, if you want to use the phones, the desk phones, it comes with it. It's a touch phones from AudioCoach to Polycom, Yelling. There are multiple vendors out there. These are a couple of pictures you can see. It's a Skype user interface, so the retrain is not really necessary. People will automatically figure it out. It's a touch button, and you can join meeting, you can receive the call. The best part is you can see the presence of other people. If you have a sidecar phones that you can configure, like Boss Admin or Nurse Stations or any other phones setup, you can see other people's presence. It's very powerful when you trying to make the call to somebody and that person is available or not before you make the call. That's powerful. That gives that boosts efficiency. You can find the right person at the right time and have these communications going without tagging the voicemail. Hey, when is available? When is he going to call me back? That sort of things is going away. It's a real-time communication. You need to know when person is available and have the contact going. And also you can see there's a couple of other devices. There's a Skype, Surface Hubs. So you can do collaborations in medical settings. For example, there is an X-ray, a tumor board, and they want to write the patients, the care providers wants to do collaborations, and there's an X-ray coming up, and you want to write in X-ray itself, and then kind of annotate what's going on. The other side is a Surface Hub or a computer. They can see the sharing. It's very powerful. Also, there are other devices, headsets and speakerphones and cameras. This is just an example, but you can see a lot of other devices that it can fit your needs to able to use and have better end user experience rather than old traditional just a telephone. So what are the features? And there are so many features in Skype Business Online. These are the few highlights I want to point it out, right? So let's talk about presence. Skype Business Client, one app gives you presence. Presence means you can see other people's availability. So before you even, as I said earlier, before you make the call, before you're trying to talk to somebody, you can see either he or she is busy, available, do not disturb, in a presenting, meeting, whatever the options is, you can see before you make the call, right? That now tells you either you can reach by email or IM or reach the different person because that person is not available. That's powerful, especially in healthcare when you need that particular specialist. You need particular nurse stations and particular pharmacy or medicine, whatever it is. You don't have to wait for the voicemail or people to call you back. You can reach in real time. The other is instant messaging. Again, if you just have a phone, if care providers doesn't have IM conversation, they cannot do multitasking. The phone only is one-to-one. The instant messaging features allows the care providers to do multiple chat window and have multiple conversation going to multiple departments at the same time. And also they can, the care providers can drag and drop and create multiple IM conferencing in the real time. So that means if one nurse is talking to another nurse and she needs help from another department, she can just drag and drop the person to the conferencing, just drag that name from the Skype client and then have this multi-party conferencing in IM just going, right? And you can escalate to audio if needed. So in instant messaging setup, in just IM, people can do multiple things. Boost the efficiency. It's robust. People can connect quickly. The other is audio video, right? Calling to peer-to-peer. If there is a setup or use case needs, somebody needs to call in video. The patient is there in the room and the doctor happens to be in different city or different departments and they need to see, and one doctor just wants to consult other doctor in the real time, and they can do video calling, and then it's all compliance. It's built into the app. Conferencing. If there's the care provider wants to schedule a conference, either knowledge workers or care provider setups or a nurse, if they want to do conferencing, and they can schedule conferencing. People can join in by phone, just dialing the number. The patients can join. The other departments can join. Not only that, they can even invite outbound. There are different hospitals or different specialists from different parts of the world, and they all can be in the conference, and it's all part of that one app. It's just it's easy to use, and you don't have to have conferencing within the company. It can go to any other part of the world. PSTN calling. So PSTN calling means in the Skype app, you can get a 10-digit number in the US, and people can call you that's directly in the Skype, like a regular telephone. And also from the Skype, you can call outbound to any other PSTN number, any other 10-digit number, or any other world, international. It's just to your phone, right? So you can install that Skype app into any mobile devices that's available today, and you can make and receive calls. It's simple as that. There's no VPN required. There's no other settings. Your username and password is from Active Directory. That's simple, right? That's easy to use. You don't have to carry your office desk number or office desk phones with you in different offices. You just use your mobile phone, install the app. That's your number. You don't have to publish your own mobile number or home number, whatever number it is. You just use the app and you rings into those devices. So let's talk about voicemail. If somebody do leave a voicemail, right, and then the voicemail will be transcribed in your email. You can read a voicemail and as like a simple email, or you can forward it. It just comes to your email inbox. It's very easy to use, and it's embedded audio file. You can even play those audio files embedded from your mobile devices or a computer. It's very simple. So John quickly talks about meeting broadcast, but meeting broadcast in the use case is, for example, it's available today, and for example, if there is some kind of disease that you want to broadcast a message, or some kind of updates you want to give it to patients or entire care provider, entire medical facility, you can quickly create a meeting. It's an event, it's an invite that creates an outlook, and you can forward to all the participants, and all the participants can join from any web browser. There's no special applications that's required. Just using the browser, they can they can see and hear audio and video, those broadcasts, right? The presentations decks from the producer. They can just broadcast, and up to 10,000 participants they can join, and it's just to message across those mass attendees. So other one is a web SDK and app SDK. I don't want to go a lot detail on this, but this is a software development kit. If the care provider wants to integrate IM and presence and audio and video calling features into their portal of medical portal, right, where patients can log in and talk about it, and they can see their scheduling, they can see their appointments, and they want to join online, and that's pretty simple to do, right? It's already available. And no cost to care providers. All they have to do is download SDK, tweak some the application languages, and just integrate into the websites. Similarly, app SDKs, you can build your own Skype app. You don't have to call a Skype. It can be whatever the medical care name, facility name, or it just back-end engine will be Skype, but front end you can make them look like something that is familiar to your to hospitals or healthcare organizations. So you can have this app published into iPhone store or Android store, so people can download those apps and use those services to reach out to the care providers. It's very, very unique and easy to use. The last one is auto attendant call queues. If there's care providers wants to have auto attendant like IVR, interactive voice response kind of things, and press 1 for hospital 1, press 2 for pharmacy, press 3 for auto appointments. You can configure those on the fly, and you can get the number automatically from Microsoft, toll or toll free, and you can assign those to those specific use case. It just literally takes about not more than 10 minutes to set up. I mean, in old traditional way, it just takes it's a process. It takes a really long time to set all this work, and even changing is very difficult. This one is all in the portal, is on the fly. Likewise the call queues, right? You can create a queues, and it goes to the multiple people and multiple attendees, multiple nurse desks or hospital setups. So it's a lot of functionalities already built into Skype for Business Online, and it can customize, it can meet most all the use cases in healthcare scenario. So let's talk about quickly presence and instant messaging. So I already talked about what a presence and instant messaging does, but if you see in this picture, it can be one-to-one, or you can do one-to-many. It's a single sign-on. You can do federation to different hospitals, different companies. It's just a drag and drop IM conference. You can just drive, for example, the Tony is talking right with Sarah, but I can drag Alex Darrow into the Tony, this chat box, and then they all have three-party conference going with IM. And you can quickly escalate to audio and video, and you can do desktop sharings. It's just easy to use. So likewise, in conferencing, in old traditional way, it's difficult to schedule conferencing because you have to remember the 10-digit number, your PIN code, and conference ID, and so on. In this Microsoft Skype with Outlook, you can just click on New Skype Meeting in your Outlook, and that's it. That's all you need. Automatically, 10-digit number will be displayed, and people can join the call with this telephone number. The conference ID is displayed. And if the user attendees happen to be in different city, they can click and find a local number. It will display almost about 400 cities in the world, and you can join locally. And there is no long distance. There is no long distance cost, so there is no cost associated with it as long as they dial into our number. So let's talk about what's CloudPBX. So Skype for Business is a platform, and CloudPBX is a feature that gives a dial tone to the phone. So Skype for Business is IM and presence and all the UC, Unified Communications bells and whistles. It's all is built in. But there are two components that requires to make that successful. Skype for Business complete telephone services, right? So that is called CloudPBX. The CloudPBX gives you all the dial tone and call forwarding, all the phone features. All CloudPBX is that's add-on. If you don't have E5, then E5 license, then excuse me. The CloudPBX is add-on service to E3 or any other services, but E5 comes with it. The PSTN calling is think of as a minute plan. So CloudPBX think of as a phone, like a hardware phone, and PSTN calling is like a minutes plan. Okay, so if you have a E5 license, then all you need is a PSTN calling. Just add a minute plan to the user, and that's it. User have the DID, 10-digit number, and can make and receive call. So assuming a user has E5 license or E3 plus CloudPBX license and PSTN calling license, you can get a number from Microsoft. You can port your numbers to Microsoft. You can get a plan minutes from Microsoft. So basically Microsoft becomes a telco at that point. And you can remove existing PBX if you want to, or if you want to keep it, that's fine. You can integrate with your on-prem PBX to CloudPBX too. Right, so it's lots of options there. Also, if you remove existing PBX, let's say you have remote offices, small medical care facilities, there are PBXs everywhere. You can reduce those footprint, and you just rely on complete with Microsoft, and all you need is internet access, and you get the telco or all the minutes and DID and calling completely from Microsoft. And you can again port your numbers, whatever those offices numbers are, you can port numbers to the cloud. You also can deploy Skype certified desk phones, as you see it below, right? Either you can completely rely on headsets, or you can get the desk phones. That's fine. You also can acquire and assign 10-digit numbers like within 2 minutes. Literally it is. You can select a country, state, and the city of your choice, and you can get those numbers immediately. You don't have to, like in old days, you have to reserve a pool of numbers and see when that number can be used and who are joining the organization, and you have to assign those number as it is available. If it's not available, then you get a pool of number like PRI, SIP trunks from the provider. That takes a couple of weeks to process. So that thing's kind of thing of past now. So with our solution, you only need to get is PSTN calling plan, and you can get those numbers immediately. Next slide. Where is it? Okay. So let's talk about what if I want to use Skype and I want to connect with my on-prem PBX. And of course, there are many use cases. I cannot remove my existing PBX today because there are a lot of business process integrated. There are a lot of users they need to train. I want to migrate, or I want to use both at the time, and we'll make the decision in the future to either keep one or integrate always, or just to use Skype in the future. So how do I integrate both systems together, right? If you do integrate both systems together, you do not need a PSTN calling plan from Microsoft, because all the calls will route through your on-prem PBX, whatever Cisco, Avaya, Nortel, ShoTel would be. And you can keep your voice trunks circuits, you can keep your existing telephone infrastructure, you can make the call in between your Avaya phones or Cisco phones and your Skype for Business client, and voicemails in Exchange or Exchange Online. So that's all doable today. Some cases you might need a SBC appliance that to connect into your legacy PBX. A lot of time you don't. So if you have a Skype for Business running on-prem today, it's easy. It's already you should be able to integrate pretty quickly. If you don't, you have a couple of options to do that. You can install Cloud Connector Edition appliance on-prem that connects to your existing telephone infrastructure. So the point is, I don't want to go too deep dive into technical, but the point is you can configure your Skype Online service to connect with your on-prem telephone infrastructure. So you can do custom dialings, you can do 4-digit dialing, 7-digit dialing, whatever dial plan is, right? You can make those so users can continue their function using desk phone or a Skype client. And as more and more users use a Skype client and they more rely on Skype client, and now you have option to either remove the desk phone or reduce the footprint completely. And again, going back to the use cases, there's start with this IT or maybe the small departments or remote mobile clinics or mobile remote offices or remote care offices. You can remove all those footprints, reduce the footprint, and start savings. Right? You all rely on just cloud. So this is a meeting broadcast sample. So if you do want to schedule a meeting for up to 10,000 attendees, you go to broadcast.skype.com. If you are using any Office 365 plan today, I think all of our plan do come with broadcast.skype.com. Make sure you have a user account, either replicated from AD or a user is already there in the cloud. You create one cloud account in one of your license. Go to portal.office.com and log in with your tenant ID. You have admin rights, and you can create the user, and that user should have that access. And you can now simply configure or create that meeting broadcast. And just when you send out the link, the attendees can join from any browser, and it can be recorded. People can go back if they cannot join the meeting for some reason. They can open your calendar invite and see the recording. That's powerful, right? Nobody will miss any meetings. And during the meeting, people can interact with the moderator. They can do Q&A, they can do Pulse, they can do Yammer. Attendees have a lot of ways to communicate. And the one more thing is the meeting broadcast can be transcripted, right? It has the translations in real time, and I think like 25 or 30 languages today. It's growing. We're adding more languages. So when there's a broadcast happening, the attendees can actually read in different languages of their choice. So let's talk about the Skype Web SDK. So it's a virtual health, removing distance as a barrier to healthcare, right? So as I said earlier, Skype Web SDK is a free software development kit for healthcare to use. You can download the kit and you can integrate into your web platform, and you can create a virtual health, like a telecollaborations, telehealth, telemedicine kind of setup, and you can customize the way you like it. The backend engine is Skype, and the patients will log in to your portal and have the Skype-like experience without knowing it's a Skype, right? So they can do IM presence and communications in real time with your care provider. There are a few our clients are actually using, right? So if you look into this one, the Skype Business Video Conferencing and Presence features mean that staff would potentially travel less and therefore use their time more efficiently, right? So ambulance service increased connectivity among staff covering 5,000 square miles. So all these ambulance services have these mobile devices in their hand, and they have these 4G connections, and they have this real-time communications with the hospitals or care provider while they are actually rushing patients to the hospital. That's powerful. They can even have this conversation going, hey, this is the case. What do we do? What's the next step? Hey, we are coming. So instead of radio or calling by the cell phone, now a doctor wants to see the patients. They can see in audio and video both and have more care options there. There's another one, eClinic for mental health using Microsoft UC. eClinic service was not intended to replace face-to-face, but now with this solution, now the patients can, the care provider can reach patients on all these remote clinics. They have this many sites remote clinics. Now the patients and doctors or medical or care providers engage more often than actually it used to be. It's very powerful for them. Office 365 enables virtual health solution. In Dallas Neurosurgical quickly connects specialists to patients. So, the specialists are in locations that they always be, or they are traveling in different places. Now, doctors, we're physicians, they want to talk to specialists. It's in a simple click, right? They have the Skype app. They can see it's available or not, and they can have this conversation going about the specific medical condition. So it's powerful to reach out to a specialist who's available, who can support that particular time for those physicians or nurses or care providers. That's very useful. It's very powerful for the medical care team to reach out to those when it's needed. So let me talk about how do I get started? How do I try the Skype for Business and all these features? Okay, so if you're not using Office 365 today at all, you have nothing going on, you can sign up for free 30 days trial, E5 trial. So go to Bing and look for Office 365 E5 trial, and you'll see the trial option. It will give you 30 days, and you can extend again one more for 30 days. So basically you get 60 days, and you can simply create users in cloud. Just once you sign up, it's very simple process. You log in to the portal. Once you create the account, you log into the portal, and you can create those users in the cloud. It doesn't have to be integrated with your Active Directory just for testing purposes, right? And you can create those, apply those E5 license to the users that you just created. And you can configure Outlook with that whatever name you created on Microsoft.com. The reason you want to create Outlook is the Outlook and Skype works together, just to see the meetings. They can the Exchange Web Services and seeing your calendar invites and all the stuff. So you have to have the Outlook configured first, and then you can configure Skype for Business. Configure means if you don't have a Skype for Business or Outlook, you can go to again that same user portal, and you have an option to download Office 2016. For the trial, so you can download those off the web, same place, portal.office.com, and log in as a user. You can install that Office bits and configure Outlook and Skype Business client with the account you just created, whatever username and password, and that's it. Now you can do most of the things. However, if you like to test telephony, please email us your tenant name, whatever name, .onmicrosoft.com to my email address in this slide, and we will create a trial code for you. It will give you option to add a 10-digit number. It gives you minutes plan in domestic and international calling, zero cost to you, and you can try all those telephony features, and it's ready to go. There's nothing else you need in terms of the POC perspective. If you do have Office 365 today and any workload, you're probably using email or SharePoint, OneDrive, or whatever workload except Skype. If you want to try Skype, the user is already there, right? So all you have to do, if you don't have E5 license, then you can just go to your portal, log in, and you can add E5 as a trial for 30 days directly from the portal. It gives you 30 days. And you can assign those E5 license to those existing users you have already in the portal, because you're using other Office 365 workload, that assuming you already have those users in that portal, right? And you already, if you're not using Exchange, then you can add an Outlook profile. You're already using Exchange, your Outlook should be already configured for particularly domain name. And all you have to do is log in as a Skype for Business. Once you apply the E5 license, the Skype for Business will light in. You can just log into Skype for Business. It will just works. And again, same thing. If you want to try telephony features and calling and getting telephone numbers and make the telephone calls, again, please email us or email me your tenant name on Microsoft.com, and we'll get the trial codes for you. And you can activate and good for 30 days. Alright, so that's it for today and this webinar. Any questions, feel free to email me. Again, my name is Samir. As you see my contact details, let me go back to my slide one more time. This is me, and this is my email address. I'm from Los Angeles. Connect me on LinkedIn. Any questions, shoot me by email, and I will get back to you as soon as possible. Thank you.